Welcome back to Healthcare Rounds. I'm your host, John Marchica, CEO of Darwin Research Group. I'm excited today. I've got Dr. Adele Webb, Executive Dean of Healthcare Initiatives at Strategic Education, Inc. And Dr. Webb is an internationally recognized nurse leader and educator. So I'm really excited about today, a bunch of different topics we're going to be going through. But, just to get us started off, Dr. Webb, you've had a remarkable career from bedside to academia and a bunch of other things. Maybe just give our listeners a quick snapshot of your journey and then what brought you to strategic education.
Sure. So first of all, thank you so much for this opportunity. I'm excited to share some of the things that we found in the survey that we did. So I've been a nurse more than 42 years. It's been a wonderful career. I love kids. So I started out in pediatrics. I did NICU, I did pediatric ER, but then I became really interested in HIV. So I started really focusing on HIV. I started consulting with the World Health Organization. I did some things with the professional organization, and that allowed me to do a lot of international work. And so I've had grant-funded international work and work that I've done as consulting. I always loved teaching. I really always believed you couldn't teach something you didn't do. So, while I was teaching, I made sure that I was practicing because I think that's really important. Maybe you've had those teachers that, worked 50 years ago and now they're going to teach you what's going on. But when I had the opportunity to go to education, I was at the University of Akron. I was at Georgetown. This opportunity came up at strategic education where I felt like I was kind of bringing it all together. So bringing my professional experience, my education experience, my clinical experience, and giving me the opportunity to work with external organizations and help them fill needs and solve problems.
Well, I like what you said about teaching. I teach as well. Right at this moment, I'm not teaching a class, but I do. And I can tell you the times when, if we're talking about, let's say, health policy initiatives or what's going on at CMS, when I can bring in what's going on at Darwin and kind of like the actual research that we're doing, and they light up. If it's a standard, from a textbook, or that's the snooze fest. So it's great when you can be that practitioner as well and bring that into the classroom. I think that people really do appreciate that. So I want to get into the survey. That's the main reason why I wanted to talk to you today anyway.
Sure.
And so the recent survey on the healthcare workforce, maybe just kind of broadly outline what the goals for this project and for doing this research, and then we can dive into some of your findings.
Sure. So, healthcare right now, and I'm sure you've heard about burnout and the nursing or the healthcare shortage and so on. I always say nurse because I'm a nurse, but I mean healthcare workers. And so one of the things we were really interested in is what can be done really to make a difference. How can we keep our providers at the bedside in the institutions? And we realized through the literature and through experience that even 5 years after COVID, the staff is really reporting being burnout and interested. I think more than half are interested in leaving their position within the next year. So what we tried to figure out is, what's a solution? Is there a solution? What can we do about that?
Sure. So it's obviously not new, and it's not surprising to me as well that you say that 5 years out of COVID, because burnout was an issue before.
Yes.
I remember reporting on this, probably 10 years ago, but exacerbated, of course, by COVID. So what you knew that going into it. Talk to me about some of the new insights that you've uncovered, and maybe some of those that surprised you.
Sure. So, of course, we found burnout. Like you said, we knew before, we knew during, and we know after. And we also found, though, that people are really interested in the ability to advance their career. So, I mean, anybody, no matter what position you're in. You're always interested in that career advancement. And so when you look at healthcare providers, what is it that we can do to help them with their career advancement? And so we really looked at, what would keep them at the bedside, keep them at the institution, and provide them the opportunities to move along in their career. And so we were really surprised to find that they're really interested in an opportunity to continue their education. Because unlike in some other positions around the world, to advance in healthcare, you have to advance your education. And so that's what they were really interested in, is how are they going to have an opportunity on top of everything they're doing, right, to advance their education.
So before, I should have asked this question first, but tell me about your sample. Who are the institutions you went to? Who are the people that you went to? How big of is the survey, and all that market researchy stuff that I get all interested in.
Okay.
but
Well,
I should have asked that question first to give me, kind of like the rundown on the details. But I'm interested in it, and I'm hoping that our listeners would be too.
okay. We surveyed over 1,500 providers. And when I say providers, I mean nurses, physicians, LPNs, and so on. We also surveyed over 300 employers. And while I don't have the list of exactly who those employers are, they did represent different market size in healthcare.
So it could be, but they're all healthcare institutions, one variety or another.
Yes.
And multiple, so physicians, nurses, multiple kinds of people. That's good to know. So what kinds of education are they most interested in? And do they feel that, this is something I'm assuming that their own institution or their companies would be providing to them? What were some of the areas that they said, hey, we're interested in this?
So when you think about healthcare, there are very defined paths that you go along when you further your education. It's very linear, and you kind of know what the next degree that is. It was interesting that so many, about 8 in 10 of the providers felt that they were being taken advantage of, even after COVID. And about 55%, a little more, said they're going to look for a job in the next 5 years. Or actually, I think it was in the next year. So thinking about knowing those statistics and their interest in education, what is it that they're looking for in that education? So they're looking for the opportunity for growth, for flexibility. They would like for it to be paid upfront through tuition assistance. And so when you think about that, you think about the employer and the fact that like 80% of the employers said they knew that what their employees wanted was education, and that would be a big retention tool. But less than half of them said that they were providing that to their employees. So it's really interesting when you have this huge shortage and you know there's a need and you know what the need is, but you're not providing it, thinking about how do you bridge that and make that available for these providers that are so important to your organization.
In your experience, I want to dive in a little bit more into this, kind of like a perfect storm. We've got this burnout issue, and then we have a shortage issue anyway, which is longstanding shortage. Are you seeing that? I think you said people are looking to exit the profession. So is it that they've said, okay, I work for Honor Health here in town. I'm out of Scottsdale. I work for
Okay.
Honor Health, and I'm gonna go to Banner? Or are they saying, even if I don't get this education, or if I'm not getting better job satisfaction, or if my burnout isn't going away, I'm leaving healthcare altogether? What is it? What's the trend that you're seeing?
Well, the trend I see is during COVID, you did see people leave healthcare altogether. But the one thing about healthcare is there's a lot of opportunities. And so I see people who aren't satisfied at one institution moving to another institution where they might have more benefits. And when you think about the burnout, I have an example. So I have a granddaughter who's a nurse out on the West Coast, and she works 6 12-hour shifts a week. Now, I've said to her,
How is that? Wait a
okay,
minute.
how?
How is that
Yeah,
possible?
I know. I know. And I've said to her, you are going to burn out. You can't keep this up. But she said, and this is the attitude of so many people that are in healthcare, if I don't do it, who's going to take care of my patients? So when you think about people burning out, how long can someone do that? Not just physically, but mentally. And she's been doing it over a year. So we're looking at by 2037 being short like 700,000 providers. Think about that number and how huge that is. So not only do we have to figure out how to get providers, we have to keep the ones we have. And it's a competition. It's a competition.
Dr. Webb, I've asked this question before on healthcare rounds, but I'm going to ask you, what do you think are some of the root causes? Let's just take nursing, for example, because I married a nurse and one of my daughters is a nurse.
There we go.
So I'm part of the family, so to speak. Talk to me a little bit about what are some of the root causes of why we just don't have enough providers?
Well, I think one of the big causes is that the population is aging. So you have more sick people, people with chronic illnesses, more people seeking care. So even if we have the same number of providers over a period of time, we have more patients. So that makes that workload harder. And I think, and this is just what I think, but when I see patients being cared for at home, they used to be in the hospital. The people on the floors used to be in the units, and the people in the units often didn't survive. And so this is wonderful, right? This is great progression of our care and keeping people healthier and alive longer. But the care burden is so much more. The patients are sicker. There's more of them and they're sicker.
What about the role of educators? One of the things I've heard is just that there's not enough educators out there to educate people who want to become nurses.
Well, there are a couple of reasons I think that we don't have enough nurses being prepared. One is we don't have enough faculty. And one of the reasons we don't have enough faculty is the pay is abysmal. I mean, I can make a lot more working as a nurse than I can make as a nursing faculty. So that has to be paid attention to, and people are looking at that. The other issue is we don't have enough clinical sites. So there are a lot more applicants for nursing every year than we can take because we don't have enough faculty and we don't have enough clinical sites. So we need to get creative with our clinical. Maybe not everybody has to do clinical at the bedside. Can they do it at home or ambulatory care or hospice and so on? And so looking at different opportunities so we can educate more nurses.
So in that particular scenario, what you're saying is maybe you can get your hours in, but it's just not in a hospital setting or it's not in a big physician group setting that you actually could get that clinical time in a nursing home or really doing kind of the heavy lifting in a home health situation where you really are giving that nursing, getting that experience in the home. Is that a viable option?
Well, I think so. So I think, less care is being provided in the hospital that's being provided in other areas. And so let's give clinical experiences in those other areas so people are really prepared when they go out and they're not surprised by what nursing care looks like.
Sure. So let's get back to the survey. And I want to ask about Gen Z and millennial healthcare workers. How are they, if at all, because we see differences around here in my company, but how did they respond differently in the survey? And do you see this workforce or this part of the workforce as having different needs or needs that you can really identify or things that came from the survey from these folks?
Well, it's exciting right now because we have 5 generations in healthcare. So to me, that's amazing. We just are the gamut of ages and career length. So I think that one of the things that Gen Z are really interested in, what the survey found is, while a lot of, I think about 60% of people said that if they were offered the opportunity for education and career advancement, they'd stay at their institution. But for Gen Z and millennials, that number was much higher. So they are interested in the opportunity to move along that trajectory, right? To advance along their career, to get the education to support them to do that.
Do you think that's, how do I phrase this question? Do you think that's just true of anybody in their 20s or early 30s is going to be thinking about ongoing education? Or is it something about this particular generation that is looking for, or that is more interested in having that additional training?
That is hard for me to answer. And we didn't look at that specifically in the survey. What I see from the Gen Z and millennials I have interaction with, and I see that they are really interested in that next step. They don't stay in their jobs that long. Every job they take is a move up, and they don't have, what my generation had. We got a job, we stayed there, it was our job, and we stay in our career. And I don't see that. I don't see that now in this, the younger generations. But we didn't ask that in the survey. That's just my opinion.
Back to, I'm not sure that you addressed this in the survey, but I've got to ask it. I feel like the last maybe half dozen episodes that we've done, the top, or maybe more, the topic of AI has come up. Do you see a role? Well, first, my first part of the question is, did you address that in the survey? And regardless of that, as an educator and as a nurse, how do you see AI being able to supplement or being able to help out in education? Because I know there are also, if you're in the knowledge economy, right, there are a lot of fears that I hear even from my folks here around AI. So what are your thoughts on that?
Well, we did actually look at AI, and healthcare workers are concerned about how that AI is going to affect them in their positions. So I think more than half of them felt that they weren't really comfortable using AI yet because it's so new and they've been out of school and they haven't been educated in that. And so really having the opportunity, I don't know if you've seen some of these robots. I mean, they're amazing, and some of the virtual care that we can give, virtual healthcare, telehealth, and virtual sitters, and so on. There's great opportunity, but a lot of people don't understand because they haven't had the opportunity to learn about it. But there was some fear that was mentioned on worried AI will replace some aspects of their job. And so, and I see that as perhaps a good thing. If it can take away some of the things, like maybe you can have talk to text charting and, save time in that way. But AI is never going to replace a healthcare provider because we have that intuition. We have that experience. We know when we look at a patient, when we go in to take vital signs or maybe give a medication, we're not just doing that. We're looking at what color are they? How are they laying in the bed? Can they answer you? Do they need cleaned up? AI is never going to do that. So I don't think it'll ever replace us, but we need to relieve that anxiety, but we need to see it as a tool. I don't consider it artificial intelligence. I see it as augmentative intelligence. It can help us. It can augment what we do.
Well, and it just stands to reason. I mean, my thoughts are that if we're in this shortage and have been for so long, what that tells me is that people really need to be more productive. But when you gave the example of your granddaughter and 6 12-hour shifts in a week, which is insane, that's somebody that needs help. And if technology, we'll just say the broader use of technology, and I agree with you, thinking of artificial intelligence, you think of it more as augmented or complementary to the work that you're already doing. If it can help you to be more efficient, I mean, just looking at the numbers, I don't know how anybody could really feel that their job was being threatened or they're going to be replaced by that, because there's so much need. and there's that gap, right, between the available number of providers and what's really needed. And maybe that's a role for technology.
Well, and I think so that fear, I think, comes from misunderstanding or lack of understanding because, these things roll out, they come, here's this new thing, here's Moxie, the robotic something. And that's a real one, by the way, Moxie. And this is what it's going to do, and not understanding how it can help you, not replace you.
Sure. I'm just checking the time. We've got a few more minutes. And as we wrap up, I'm going to kind of put you in that advice mode, and just ask if you were to be, based on everything, some of the highlights that you've learned from the survey, some that you've talked about today, if you could give health system or hospital executives some specific steps now, things that you've learned, things that they can do, because I know a lot of them are listening to Healthcare Rounds. So if you could give them some advice on one or two things about rebuilding morale, stability, combating burnout, what would you tell them?
Well, I think there's a few things you can do. I think one is ask the right questions. So let's say a healthcare executive is doing a round and they say, how you doing, or how's it going today? People just say great because they just want rid of them, right? They don't want to spend time and talk to them. They have stuff to do. So ask a different question, something like, if I could change one thing to make your job better today, what would that be? And start to really listen to what people want and what they need. The other thing is make sure they have that opportunity at being flexible. Think about, boy, I might be really interested in working in the ICU, but I've never even been in the ICU. Can they shadow? Can they get that opportunity to see what it's really like? Or maybe ambulatory care or home care. So give them that flexible opportunity to learn more about where they might want their career to go. And then not just offer the benefit of tuition assistance or tuition reimbursement, whatever they want to call it. Make sure people know about it, understand how to use it, have it so it pays up front, so that they don't have to have out of pocket waiting on that to come back. Just think, so many of our nurses, especially the millennials, they have families. They might be taking care of parents, they're taking care of kids, they have their community, their church. All of these things they're trying to do. How are they going to pay out of pocket and wait to get reimbursed? What if that payment is up front? And so I think these are opportunities that so many of it is just lack of knowledge on the employee's part. Let's let them know. Let's offer it. Let's let them know, show them how to use it, and have some flexibility in where they can go. So it's not like we have this deal with this place and this is where you're going to go, but say we have these opportunities for you to pick among and give them those choices.
That kind of dovetails with my last question where I was going, and I think you've kind of answered it, but I'm going to give you a chance to expand on that. And that is how proactive. In the beginning of our conversation, you mentioned that I forget the exact percentages, but that employers understand that education is a key driver and that it needs to be done, but yet I think it was less than half or something are actually doing something about it. So how proactive do these organizations need to be with their learning and development programs? In other words, I understand it shouldn't be just enough to say, oh, we'll do tuition reimbursement or something and you go find whatever. What in your mind, if you were kind of helping the C-suite of these organizations, how would you be more proactive, or should they be more proactive? And what would that look like?
I think, so my opinion, what HR needs is like a platform that you can go to. First of all, they need to make sure people are aware and not just tell them about it when you hire them, but have flyers, put it on the whiteboards, get the information out there. And if it's cyclical, like if you can only do it during certain periods of time, make sure people know. And then make sure that it's really accessible, that people understand how to use it, where to use it, what their choices are. And if you have a platform that they can just log into, maybe on whatever server or things you have at your institution, so they can go in and see, I can take a baby step here. or maybe I'm interested in over here, but give them those choices very visible to them so that they see what their opportunities are. The other thing I think would be really important is career development coaching. And some platforms have that. So yeah, you put in, I want to work in ICU. What do I need? And then it says, okay, these are the things that you need, and then give them the opportunity to get those.
And maybe that's one of those areas where, again, if you don't have the staff in the HR to be able to do a lot of that one-to-one, where some of the newer technologies and some of the AI may be able to help craft these plans for people, right? I mean,
absolutely. Yes.
So, all right, final question, and then we're going to do some lightning rounds. How would you measure, after everything that you've learned from the survey, and then, of course, your extensive experience, how would you measure whether one of these new kind of education programs or initiatives, how would you measure whether that's going to be successful?
After it's implemented, you mean?
Mm-hmm. Yeah. What kinds of things would you be looking for to know, hey, we're on the right track?
I'd be looking at usage. So are people going to the website or whatever it is and getting more information? Are they signing up? But the other thing is persistence. Are they staying? So if they're going to the website and they're signing up and they're not successful in their courses, what's the issue? Is it scheduling? Is it flexibility? What can you do as an organization to help them be successful?
Love it. All right. You ready for some lightning round questions?
I'll try.
One word or one phrase answers. All right, here we go. Single biggest challenge facing healthcare leaders right now?
Shortage.
A reason for optimism about the healthcare workforce?
Excitement around the profession.
I love this. The most overused buzzword in healthcare education?
I guess I don't have one. I don't have one.
That's fine. That's stumped on a
Yeah.
lightning round. That's fine. One innovation or technology that you think will genuinely help clinicians?
Virtual healthcare.
And finally, a book, podcast, or resource that you'd recommend to health executives thinking about your workforce strategy?
The Patient Comes Second.
Interesting.
That's a book.
I love it. Dr. Webb, thank you for joining today on Healthcare Rounds. And so where can listeners learn more about your work and survey findings? How can they find you?
Okay, so we are at strategiceducation.com, and I encourage everyone to take a look and see what we offer, see what we have. It was an exciting survey, and we're hoping to really capitalize on these findings and help organizations move forward.
Great. Thanks again, Dr. Webb. And thank everybody who's listening for listening to Healthcare Rounds. That'll do it for this episode. If you enjoyed today's conversation, please don't forget to subscribe and share the show with your colleagues. And we'll see you next round.
Thank you.